Thanks, everyone. Thanks for joining us again today. This is the second annual Midwest Healthcare Summit. Very excited to have, to my right, Mr. Terry Rapoch. And the genesis of this conversation, this talk, is Terry and I have had several conversations over the last year or so since the last session here. The conversations, at least in our opinion, is somewhat stimulating. And one of the things that we wanted to share with folks is some perspective of what boards care about, right? What boards want from a cyber risk management standpoint. And that's one of the challenges that I see continuously in the industry is folks struggle with understanding, determining what do we report to the C-suite, what do we report to the board, what kind of metrics, what kind of information are they looking for. So it's going to be a back and forth kind of dialogue with Terry and myself, him doing most of the talking. But Terry, if you could, can you share a little bit about CareSource?
Sure. CareSource started in the late 80s as a managed care provider in the area, particularly related to Medicaid. Currently has about 2 million members in 5 states. So beyond Ohio, which is sort of the primary base for CareSource, they also have plans in Indiana, Kentucky, Georgia, and West Virginia, and have expanded out beyond Medicaid into Medicare Advantage and also to the exchange business based on the Affordable Care Act. So currently revenues are about $10 billion a year. When I started with the board in 2011, they were just around $2 billion. So phenomenal growth in the organization, tremendous challenges in terms of scaling infrastructure and dealing in a highly regulated, highly compliance-driven environment. And we'll talk more about that as we move through this conversation.
Awesome. And at the end of the conversation, if anyone has any questions, feel free to please ask. So the first question, let's level set. What's the purpose of the board?
So there is this traditional split between governance and management. Boards are responsible for governance, management is responsible for the operations and guidance of the company on a day-to-day basis. The key thing is that boards are that sustaining element, that they have a life beyond the life of any particular manager, any particular management group. In fact, one of the major accountabilities of boards is to choose chief executive officer and the leaders of companies. And they are responsible for the ongoing viability of that entity from a financial, operating, and also particularly with respect to a nonprofit such as CareSource, the issue of adhering to their mission and not deviating from mission. So the board has this sustaining long-term view of the organization. Therefore, its interests are more strategic in nature than operational in nature. They delegate those responsibilities to management, and as President Reagan said, they operate on a trust but verify kind of basis. That they will provide insight, they will provide additional resource to the management of a company, but not engage in day-to-day operations or day-to-day issue management. And so when you talk about, for example, as we will, the area of cyber, it's much more at a strategic level that the conversation becomes engaged with the board rather than down in the bits and pieces that comprise the management of the cyber environment and the potential issues that arise from that relative to the performance of an organization.
So we often hear the word governance in cybersecurity and cyber risk management. And what we're talking about here, Terry, isn't the tactical version of governance. It really is that strategic top-down view, isn't it?
Yeah, boards concern themselves with the 3 aspects that drive all companies. First and foremost, are they going to be viable, both in the short term and long term? And what does that entail in terms of particular strategies and means for accomplishing that end? Secondly, they concern themselves with being competitive. So for example, if you look at a Medicaid provider and the evolution of healthcare, government-provided healthcare in the country, one of the questions you get into is entry into the Medicare space. Reason for that is we're now seeing the evolution of what are called dual eligibles. That is, people that qualify for both Medicaid and Medicare. So if you have no experience in Medicare, which is a very different animal than Medicaid in terms of how the plans are executed and what the responsibilities are, if you are not involved in both of those, then you will not be competitive in the potential markets around things like managed long-term services and support. The third thing that, that boards concern themselves with, beyond the competitive issues and the financial issues, is this issue, and it's particularly true for nonprofit boards, the question of value. How does the organization add value? Now, we all know that value can equate to profit, but in the nonprofit world, it really equates to outcomes that you're trying to deliver against who you see to be your members. So in the CareSource case, the view was that they are dealing with a typically underserved community. I mean, healthcare is a complex environment in the US. Now, as was mentioned, I grew up as a hockey player in Canada. Not a good one, not a good one, but I played hockey. It's genetic, can't help it. So in Canada, the last thing you ever worry about is healthcare. You start a business, you don't worry about healthcare. You move from Alberta to British Columbia, which I did, you don't care about healthcare. Why? Because there's a single payer system across the country. You show up at a hospital, they fix you up, you never see a bill, life's good. My wife and I had 3 children in the city of Toronto, excellent care, all that kind of stuff, never saw a bill. Now, correlate that to your experience here, where a simple accident can result in bills from a myriad of providers and other elements. So it's very complex. So one of the issues that CareSource took on was how do you provide care in that environment, in the Medicaid environment, to people who are traditionally underserved with respect to healthcare, because they simply don't have the means to afford it. And so that mission becomes that overriding value proposition that they bring. And so no matter what resources they bring to bear, the key is to understand how that works. Now, as a managed care provider, you also sit at the nexus of a patient, a provider, and the government. Medicaid, as you know, is a state funded with federal support, Medicare through federal funding. And you are, as a managed care provider, as CareSource is, refereeing a set of relationships there. What care should a patient receive from what provider with what compensation that the government will agree to pay for? And basically the model that they have is called a capitation model. Some of you are probably familiar with that. CareSource receives a certain amount of money per member per month to deliver care. The care has to be accessible to its members. The care has to be of high quality in terms of outcomes to its members. And the view is that it needs to be managed in a cost-effective basis. That's a complex world to live in. So when we talk about the value proposition, one of the things that a board at a nonprofit like CareSource concerns itself with is, are we getting mission creep? Are we straying from that view about well-being? Are we straying from that notion of dealing with communities that struggle with their own health care? So those are the 3 things that always become sort of the substructure to any judgment about, should we enter this? Should we do that? Should we put in a new system? Should we, undertake a new geography for service? So those are the things the board concerns itself with, as opposed to, how do claims processing work? That's a management issue. They deal with that. So the other thing I will tell you that boards concern themselves with, of course, is succession. Leadership succession, which in turn implies management succession of the organization. And that is a critical responsibility to ensure the long-term viability of an organization.
So Terry, can you share with us a little bit about how a healthcare board, a healthcare nonprofit board, other ways that they're different from a typical for-profit board?
So I mentioned the issue of mission. So that's a clear differentiator, but let me talk a little bit about healthcare. First of all, there was a commentator that said that the US economy is a healthcare economy with a side order of defense. And when you look at it and you look at the numbers, that's pretty close to the truth. Now, while still a large percentage of Americans are insured through private insurance through their employers, the size and scope of federal spending in the healthcare space is become huge. And so there is this concern about how to bend that curve, how to reduce the cost of healthcare. Now, you've all heard about the work in Ohio relative to Medicaid expansion. added some 700,000 people to Medicaid by changing the qualification. When those individuals came on board, their health care costs were far in excess of others who had received common health care, common Medicaid and common well-being or management of their health care. Why? Because there was a backlog. After about 3 or 4 months, the spending stabilized, but it shows what happens when people are not in coverage. So there's a lot of money, as I like to say, sloshing around. And whenever there's a lot of money sloshing around, people get concerned about how that money is being used. There are concerns about, I can go down the list, kickbacks and all sorts of things, and you've probably heard of lawsuits and so on involving healthcare organizations. So the other side of that is that CMS, as the managing organization, the Center for Medicare and Medicaid Services, has a view that says quality care, accessible care, cost-effective care. So when you have a lot of money sloshing around, the next thing that happens is you get a lot of regulation and compliance-related issues. That's the next thing that happens. Because you're concerned to make sure that the money is spent appropriately across millions of people, across very complex human conditions, which is the other part of healthcare that makes it different. At the end of the day, you're dealing with human lives. And whether or not you render care effectively or ineffectively is not a matter of whether it's a convenience or an inconvenience. It's whether or not somebody lives or somebody dies or somebody has a reasonable quality of life. Those are fundamental issues that a society deals with, both during the adult years, but also certainly with an aging population that we have today. So a healthcare board is different to the extent that its mandate at its core to improve the well-being of its members is a crucial responsibility. And it's one that gets enacted on a day-to-day basis by individual interactions between healthcare providers and their patients. And the plan provider is there to make sure that that's going on appropriately. So healthcare boards worry a great deal about whether or not that's true. Is that what's going on? Is the care being managed? Do we have the appropriate network to deliver the care that's required? Do we have the correct follow-up visits? There's a host of things which are then subject to regulation and compliance. And this extends over when you look at information technology and the cyberspace, which we'll talk more about. HIPAA was developed and put into law for 2 reasons. One of them is privacy, but the irony is the other one is access. So the other issue that boards concern themselves with is the imbalance, certainly at the CareSource level, the imbalance in the position of patients versus providers versus the government versus managed care plan providers even. Patients do not have a lot of information in many instances about their own circumstance, nor do they have information necessarily about what it's going to cost for the services they receive. Ultimate irony. I don't know how many of you had the experience of saying, I need an MRI. How much your MRI cost? Well, in my case, it varied between $5,000 and $350. Now, I'm a scientist, so I can sit there and go, oh, I used to do MRI when I was in university. What's the difference between a $5,000 MRI and a $350 MRI? And if I had to pay for that myself, how would I make that judgment and decision? So there is this question about how do patients get the information that they need, and one of the responsibilities of a care plan provider is to help sort that through. Now, I'm sure all of you have heard about blockchain and the potential applications of blockchain, and clearly healthcare is one of those domains where it might work. Because right now, every time that you go to a new doctor, I guarantee every one of you fills out a wad of documents about who you are and what drugs you take, and on and on and on. I had one about, when did your mother die? How old was your mother when she died? And I said, well, you know, she was 95. And then it says, reason for death. You know, 95. I'm kind of like, you know. So I'm wondering why every time I go to do this, I got to go through that. Why can't I control the records to the point where we don't have to go through that nonsense? Which, by the way, has an offside which says you could walk into a doctor unaware of your previous conditions. I won't talk about prior conditions. And they could provide a drug or prescribe a drug for you that was contraindicated against prescriptions already provided. And the consequences could be serious. So how do we deal with those peculiarities and complexities? Recently, a couple of years ago, we implemented ICD-10. Went from 9,000, 10,000 some odd codes to 55,000 codes. Okay, now in an adversarial payer system, which the United States operates on, figuring out what codes to apply is a pretty complicated business, since things also have to travel together in logical groups. So if you're in for an appendectomy, yes, you cut the skin, yes, you did this, yes, you did that, but it's not necessarily a license to go rooting around to do other things. So what it became is a question of coding. I code it this way, you disagree, you think it should be coded that way. 55,000 codes. So if any of you want a job, if you're tired of your current occupation, go back to university and get training in becoming a coder of medical claims. That industry is growing leaps and bounds. By the way, I suspect is one that will get heavily targeted for the implementation of some form of artificial intelligence. Why? 55,000 codes. I mean, I have trouble figuring out what iron to use on a par 5. 55,000 codes, the opportunity for error and mistake, the opportunity for inaccuracy in terms of the recording of incident. So that's why healthcare has these characteristic differences. We're dealing with human beings, and we're having to deal with them in an environment that requires a tremendous degree of precision and necessarily complexity in what is ultimately a somewhat adversarial environment.
Excellent. One of the interesting takeaways that I got out of Craig Brammer's talk, keynote this morning, he's the CEO of the Health Collaborative here, he said 20% of outcomes in healthcare, 20% of the outcome is healthcare driven. So the 80% is environment, habits, et cetera. And I hadn't heard that before. That was staggering. And trying to manage all of that total care is a significant challenge. So changing gears now and maybe getting into some of the stuff that most of us care about here, since this is a cyber heavy audience. How can boards best understand cyber and the associated risks?
So let me just pick up on the comment you made about the 20%. There's emerging theory about what's called social determinants of health. That is that a person's health and well-being is not just a function of the medical care that they receive. So there is a great deal of work going on about that and how to address issues like generational poverty and the impact that it has on healthcare and wellness, and how do you deliver in those environments. How do you deal with behavioral issues that create long-term health problems and so on. To ask about boards and cyber. Well, first of all, cyber is a useful catchword for a lot of things. So I went to the NATO website. I figured NATO's got to know something about cyber. And their opening paragraph says, well, there's lots of different interpretations of cyber as to what it is and what it isn't. So part of the problem is we have a word that gets used as a flag. Cyber attack, cyber war, cyber commands, cyber threats, and so on. And so boards, when they get into that world, are tremendously influenced by the general base of information that's provided around cyber and that comes out of the news cycle. Nobody talks about what didn't happen. Everybody talks about what did happen. Anthem got hacked, 500,000 records, or how many ever records, by the way, which are never commercialized. So we always talk about those issues, right? So when you're at the board level and you're thinking strategically, now all of a sudden there's this whole new element of risk that's being introduced. I mean, you're worried about your capital amount of capital you had available. Did you have enough of that? Various things like that. And then all of a sudden we've got to deal with cyber. And cyber is this sort of multi-partite, multi-headed beast that comes in. And to be honest with you, what boards would like to know is we're okay, right? I mean, you got to imagine meeting every 3 months, quarterly, and somebody says, how's cyber? What answer would you like? Medium? What you'd like to know is, you're okay. Only the question is, how do you define what okay is? And there's a sort of a checklist, that the National Association of Corporate Directors have put together. I mean, do you actually have a cyber management infrastructure, some kind of security infrastructure? Probably built on the old IT infrastructure, but now it's got the cyber word, so we think it adds some things to that. You want to know, are you spending enough in this area? Have you been hit with attacks, ransomware, other things which have affected your ability to operate? So at a board level, that's kind of where the conversation sits. Want to know that everything's okay. And you want to deal with it at a risk basis at a board. Boards are about risk. They're not about issues. One of the things that I see a lot is cyber leads to a whole discussion about issues. Well, we have this problem or that problem, or this happened or that happened or the other thing. The question is, what's the real risk? What's the asset that you have that could be attacked, and why might it be attacked? That's what the board would like to get to. That kind of understanding of, so these things that you're doing, this cyber infrastructure you've built, the training you've done, the awareness about phishing, all of that type of stuff, is to protect what at the end of the day? What's this thing I'm trying to protect? The thing, by the way, that inevitably doesn't appear on a balance sheet, just so we're clear, which is a huge problem as far as I'm concerned. So, you're a healthcare provider like CareSource, and you have 2 million members, which means arguably we have records, fairly detailed records on 2 million people. So what would you do with the detailed records on 2 million people? Why would you want to attack that?
Integrity.
Pardon?
Data integrity.
You would sit there and say, well, what could I do with those records if I could get to them that might affect my ability to execute my mission, my ability to seek and capitalize on additional opportunities? How would it affect the integrity, the view of the organization in terms of its integrity, in terms of its quality of service? So if you went in there and messed with those records, all 2 million of them, in a certain way, could you in fact lead to that kind of outcome, to some kind of compliance action, some kind of regulation-driven action? And as a result of that, the organization now either loses opportunities or is directly exposed to losses. But it's the conversation at that level, not at, I'm going to deal with this problem right now. It's, so what am I trying to protect, and why is that of concern to me, and what do I think the strategic outcomes will be if that's compromised? And, oh, by the way, I really just want to know I'm okay. Am I spending enough? Because all of you in this room understand this is an onion. I mean, you start peeling the cyber onion, it's like if you look at NIST 800-53, I mean, you're kind of like, oh, okay, that's really a good framework, but there's a lot of bullet points in that framework. And that's just the bullet points. How do you actually deal and action those, and how would you communicate that you are effectively dealing with access control to a board? Understanding that access control is a big issue, particularly about the social engineering part of that. So that's the challenge boards have. The challenge boards have is being able to be given a big picture that gives them the assurance that the assets that they're concerned about, that underpin your business, the capabilities that underpin your business, including cyber, are being properly stewarded, are being properly taken care of. And accepting the fact that no matter how good the intentions and how good the implementation, there is always going to be some likelihood that something bad will happen. What you'd like to make that is increasingly difficult to do, so it becomes diminishingly small a possibility or probability. But that's about all you can do. Either that or simply get out. Understand one of the best strategies is not to take on things that expose you to more risk. Companies are not good at that. They get in their head, we gotta grow, we gotta do this, we gotta do that, we gotta do the other thing. And what they're not looking at is maybe how big is their attack surface becoming? How exposed are they? How much control do they have over vendor relationships? Those types of things. So the question would be, should you go do that? Question at CareSource. We got into that conversation. Should we go into Georgia? Should we go into Indiana? Well, understand in the regulated healthcare space, the federally regulated healthcare space, it's kind of like playing baseball. The governments of the states decide when the game starts and when you're at the plate. It's that simple, right? They're going to say, we're putting out a license for Medicaid coverage for this state. And you're either playing or you're not playing. And normally the lead time on these things, and yeah, you probably figured out it's coming, but the lead time to get a proposal together on that's normally not a huge amount of time, and they're very impatient to get it done. So what are you going to do? I mean, if it's your only shot to get up to the plate and swing at the ball, what do? You step up to the plate and swing at the ball. Do you think there's a possibility you overcommit? You can probably overcommit a little bit. So I went after federal funding a number of years ago and state funding. The only thing that was clear to me is it's a bit like bidding on real estate, right? In a hot market. What are you going to do? Well, I'll meet your asking price. Well, you and 15 other people are going to meet the asking price. What are you going to do? So there's this issue in that space about how that works. So sometimes you just have to back away, say, I'm not going to do it. Or you have to agree on your strategy to say, I'm not going to take that on. Somebody else is going to take it on. Otherwise, you should either just accept that what you're doing has risk, and that's a cost of doing business. I mean, hopefully the pebbles in the shoes don't become boulders, but that's the deal. Every business has a level of noise of risk, and you have to decide if that's acceptable or not acceptable. And that's stuff that boards struggle with, is knowing, getting the right information to make that judgment to support management in their decisions to undertake those types of actions. And it is at the board level that that responsibility, in my view, exists. Because they are going to carry on long after the management group leaves. They are going to be accountable through fiduciary responsibility and other things. So how you bring information to them about these types of risks is key. And when we look at cyber, it's particularly complex because of the nature of the subject matter, right? How do you get people up to speed on something that some of you in this room have spent years becoming professionals in? I had a friend of mine, his father was the chancellor of McGill University. He became a lawyer, pretty good one actually. And his father served on the board of Bell Canada. Now, some of you may know about Bell Canada, but essentially it was the Canadian communication monopoly. Provided telephone service. It was the Canadian AT&T, named after Alexander Graham Bell, inventor of the telephone, who happened to be in Boston at the time. He sat on that board, and they were making decisions about all sorts of things, strategically. Where do we put the microwave networks? Where do we do? And he said, you know, after a while, his father said, it's kind of like the schoolyard, a little bit like the schoolyard. You got a bunch of people who have some comfort with each other, that they have the best interest of the organization and each other at heart, and of all the stakeholders, and they sit there and say, what do you think? Oh, I think it's a good idea. And because you think it's a good idea, other people think it's a good idea. Because it's all about kind of a relationship of trust. And I think that that's true in a lot of cases, because it's too complicated otherwise. It gets very complex. So it'd be nice if we all, you know, had a pH scale for organizations and the board dipped a stick in it and said, oh, 8.3, this isn't good, right? Or 1.7, this is really not good. But that's the hard part, and we're going to talk about that a little bit more, I think, of how, as professionals, do you communicate with a board at that kind of level? Because that's where the dialogue needs to take place.
How many folks here in healthcare, like a provider or payer or somebody, show of hands real quick, how many folks have board members that are dedicated or tasked with owning cyber in some way, shape, or form? couple? Anybody else? So one of the things that struck me with Terry, and you can probably get a sense in just listening to him, is that he's done a lot of homework. For someone that didn't come from, quote unquote, the cyber world, although you do have an IT background, I mean, he has invested a lot of time in learning the vocabulary and the process and procedure and stuff of cyber. But it seems like, especially in healthcare, that seems to be the exception, not the rule. Any thoughts on just in a general sense, you know, how do we as an industry continue to push that ball forward and getting more folks on board with that? No pun intended, on board with that.
So, finding people who can straddle the world between the board world of governance to the C-suite and communicate at that level and deal with those types of issues, it's not straightforward. There are programs, by the way, to help in that regard. And increasingly what's starting to happen is that boards are creating committees. They always had an audit committee. We always know about that. They had to have that audit committee, and they had to nominating the governance and so on. Well, the committee I serve on is audit, risk, and compliance. Imagine what those meetings are like. They start early, they end late, the briefing books are thick, right? What we're seeing further than that is organizations are pulling off compliance. And some of them are pulling off compliance, and some of them are pulling off cyber. They have accepted the fact that they need much more in-depth understanding of what's going on within the committee structures that can then report up to the board. So that's one way you can do it. You can engage professionals through committees that don't require board membership to build a committee that understands the issues, can talk about them with your internal security personnel, and then boil that down and take it up to the board level. So that's a strategy, which is to create that kind of expertise. The other is to look at how you evaluate and select members for your board. So in the good old days, right, we always knew that we had to have a financial person on the board. Always had to have some financial person on the board. It was always good to have a legal person floating around sort of the periphery. You wanted people with industry experience. Well, now I think starting to see that boards are going to want to have people with this kind of cyber background, who understand it at a strategic level and what the implications are for the businesses that they're responsible for, and how to bring them on the board. And if they need other skills to make them effective board members, to add those additional skills, rather than to create cyber experts out of people that really, that's not their wheelhouse. Just like my wheelhouse is not being a CFO, trust me. So if I were to look at, do I think board members, you know, CISOs, for example? No. So I have to look the other way. I have to look at, do I have people that would qualify the other way and bring them on, and then add the other attributes that I want to see out of my board members. Is it happening? It absolutely is happening. You know, it used to be land, labor, capital. That was the deal. Oh, and entrepreneurship. That was the deal. You got land, labor, capital together, Adam Smith, you got synergy, you got synthesis, poof. You got negative entropy situations. Things were getting more organized. Well, now you cannot take the cyber part out of this. Why? Because the businesses we're running today and are going to run in the future, and healthcare absolutely in this wheelhouse, are going to be rooted in the ability of systems to deal with both the operational capability and the data management capabilities that are required. And as soon as you make that statement, then the next thing out of your mouth is, what risk does that define or establish for the organization, and how now do I have to accommodate? My analogy may be reading, writing, arithmetic. How many of you remember that from school? Right, all of you got the hand up, yeah. Reading, writing, arithmetic. You know what, reading, writing, arithmetic? That was designed by the British to train a workforce for the British Civil Service in Britain and the colonies. And I dealt with that, quintuplicate forms with carbon paper and all of that. Everybody had to read, write, do arithmetic. Question, is that appropriate for students that I teach in high school today? Is it enough? No. I see high school students lugging bags of books around, and I'm trying to figure out why. And the answer is the IT people at the school are absolutely paranoid about what these kids could do on networks. And by the way, not only could do. Let's be clear. There are really, really some creative and imaginative kids out there who do stuff with things that were built for one purpose and it's simply repurposing. So now we've got this fundamental shift. And it's echoing through our economy and it's echoing through healthcare. And we know that. But with, to quote Spider-Man, with great power comes great responsibility kind of thing. And that's what we've done. The lid came off Pandora's box. And now we're living with that consequence. And I would tell you that in the enthusiasm of growing IT capability, we didn't necessarily look at the dark side that closely. When you're giving things away, you don't necessarily look at whether or not you should or shouldn't be doing that. So what I think is going to change is I think the nominating and governance committees on boards and the boards themselves are going to look to a more professional capability, both within their board members and also within their committee structures and their ability to engage effectively with people who know what they're doing in this space.
That's interesting. As you were mentioning the finance side of things, that you're not a CFO, it's probably a little bit easier to teach a cyber person, per se, how to read a balance sheet and a profit and loss statement than it is to teach a finance person cyber. But another question I have for you, Terry, is how should IT and cyber teams structure their board briefing materials?
So I mentioned that all the board wants to know. Everything okay? Are we good? Right? That's what they want to know. And moderate is not a good answer. Medium is not a good answer. Everybody wants a clean bill of health in a world where you can't get one. So there's this desire. So I put together some thoughts around, so what would I really care about as a board member? First and foremost, I need to put this in context. Right? If I'm going to judge where we are on something, I have to have some basis, some context for making that judgment. Now, the trick is that there are a lot of such frameworks and so on, if I look at the NIST stuff and so on. The trick is to boil that down into something that is manageable. And I have a 3 to 5 rule. If you go much beyond 3 to 5, if you're off your fingers, or if you're below the fold on the first page. So find a context for this. And that context should be aligned to the strategic issues of the firm, not to the issues of cyber in that sense. Make them about the firm. Make them about competitiveness. Make them about mission. Make them about profitability. Make them about value. That's context. The second thing that I struggled with as board member sitting on committees was the issue of consistency. I worked at NCR for a while in their IT group, and we changed our metrics all the time. I don't know if we didn't like them or it was just more fun debating them. Consistency is a really important thing. You cannot change horses midstream on this stuff. You can't say today this was important and tomorrow that's important. People get confused. If you looked at something every 3 months, that was the only time you looked at it, and you couldn't make the pages even line up, you'd struggle. Is it good or bad? Was it good or was it bad? Are we going in the right direction or the wrong direction? So consistency. So context and consistency are very important, as is continuity. So you sit there, again, every 3 months you go into this meeting, and you're trying to thread together what is in fact an evolutionary pattern that's impinged upon by external factors that you may or may not be aware of, like, or control. So in the regulated space, it can change like that. Suddenly changes and you're done. Or it can come from the technical space. For example, what's going to happen when 5G networks are suddenly in place? What do you think that's going to do to the healthcare industry? What set of issues will that open up? Clearer capabilities, but what other set of issues does that open up? And how do I bring that in? So when I look at it, I want to understand continuity. I want to understand how these pieces thread together over time. I don't want to be confused about how we're progressing. Yes, I want medium to become not medium, right? I want good to become better. I want better to become best. So if we're on a journey, let's talk about the journey consistently. You know, a number of years ago, I was in the Metropolitan Museum of Art in New York City. And I walked in this room and there was this huge picture on the wall. And it was a picture, I mean, there was a bunch of mountains and there was a sunset, and the closer you got, the more detail you saw. Phenomenal picture. The title was something like Going to California. And as you got really close, there was this guy down by a river with a broken wagon wheel, fixing the wagon wheel. You know, and the question would be, why is he fixing the wagon wheel? There's probably, you know, it's dark, it's wet, there's mosquitoes, all that bad stuff, and he's fixing the wagon wheel. And the only reason he's fixing the wagon wheel is because he's going to California. You want to know about the journey. Otherwise, you're just fixing a wagon wheel in the middle of the dark. Sort of dealing with it. And I wonder sometimes if that's what we lack in some of our narrative and discussion. We're fixing wagon wheels with no view to we're going to get across those mountains and we're going to earn the Rockies and we're going to earn California. But we're down here. I got to get this wagon wheel fixed. Okay. But why? What's that context? And what's the continuity? What's that message? The other thing is to be concise. Lots of slides. It's not going to do it. It's just not going to do it. You have to be concise. You got to be able to boil it down into literally a series of relatively small bullet points. Short. Like I say, I'm a 3 to 5 guy. It's either poison ivy or something else. And my reason for that is, again, if you saw something only once every 3 months, how many pages of this do you want to wander through to try and figure out what matters? Right? So conciseness is the other thing you want to look at. I want to be concise about what I'm putting together. Which, like I say, you could probably talk volumes about fixing a wagon wheel. I guarantee you. What kind of wood to use? So, yeah, I got to heat the metal up. I got to do this down here. Concise is, I'm going to California. John F. Kennedy, we're going to the moon. How? Why? Right? But at least we could then figure out what we were going to do along the way. And it's the same with the cyberspace. And I don't think there's been enough discussion at that level about the issues. It seems to me that sometimes we just get wrapped around the axle on, we hit this, we bump into that, we do that, and we're highly reactive as opposed to strategic in our thinking about what we should be doing in that regard. The other thing is confidence. When you're talking to boards, you need to have confidence in the message you're bringing, that it's grounded in what they care about, and that you're confident that you understand that and how it relates to the mission that you've been given. So, because ultimately, it's like that playground I talked about at Bell Canada. It ultimately does become an issue of relationship. You know, and when you're sitting in a boardroom, maybe for your first time, you want to make sure that you exude the confidence and the competence about what you're doing and why you're doing it, that the board can take stock in, and that the next time you come back, they're going to be interested in what you have to say about the journey you're on. Not, we fixed that spoke, but we're making progress. Here's where we are, we're going to California. So that would be my thoughts about when you're communicating to a board. And one last thing, if you can, use numbers and don't tell people what they already know. I work for a guy, Ted Rogers, up in Canada. Some of you may see his name on the ballpark up in when the Blue Jays play. Ted Ted parlayed about 85 grand into a company that probably pushed $15 billion. He was in radio, TV, and stuff, and he was one of those guys that could change the temperature in a room when he walked in. He was a true visionary. And he owned the company, and so even if the vote was 9-1 against, we always agreed with the one and went on and did stuff. You know, but I always remember, because he was always pretty charitable for a guy that had that kind of characteristic. I mean, really, really big risk taker and so on. He said, just don't tell me what I already know. Don't do that. Don't tell me what I already know. Tell me what I need to know and tell me what you think I should know. But don't tell me what I know. And I would put that out. That's a real challenge. So I'll leave it at that.
So one of the things we've talked about a lot, Terry, and if you could just 60 seconds on risk, because there's a lot of definitions of risk, of you know, high, medium, lows, and probability and all that stuff. One of the things that I hear consistently is, well, if we get into all that risk stuff, the board may not understand it, or the C-suite may not understand it. And sometimes I push back. It's like, well, that's kind of their job. They deal with risk all the time. But final thoughts of wisdom on how folks can approach risk, do a better job communicating.
At the end of the day, I mentioned it earlier, being on a board is not about managing issues. It's about governing risk. It really is. And the problem I have is I sit in a lot of meetings where we think we're talking about risk, and we're not. We're talking about issues. And issues are things that have happened. They're risks eventuated, if you will. And there should be a plan to deal with them, and somebody should be responsible, and there should be a date, and on we go. Risk is more subtle than that. I'll give you a risk. My company cannot innovate fast enough to remain competitive. That's a risk. That's a huge strategic risk. How many companies have not been able to innovate fast enough to stay in business? And if you knew that to be true, if that was were a real risk, what would you do about it? So the question then becomes, so if that's a real risk, when do you think it eventuates? When do you think it gets to the point where the frog in the pot really finally says, uncomfortable, we need to do something? So I said, so when I see the likely and high, and I'm back in the world of medium. We're medium, we're average. Don't like that. So I'm a great believer that risk is this issue about, so what do you think, how big a risk is this in terms of impact? And you need to be able to quantify that. You can't just talk about it in qualitative terms. If you think a risk will put you out of business, then you need to be able to say that. And that's not the word that says extreme. You need to write down, this will put us out of business. And our business is currently worth $10 billion a year. And we're going to go out of business if we don't deal with this. Now, what's the likelihood is that that could occur? As I mentioned, when you're working in the government contract space, can be as easy as a signature on a piece of paper, and you're done. The best story I heard about that was a company was financially sound, everything was good. They came to work one day and the doors were locked. Why? The EPA had come in and found asbestos in the building and they locked the building. Done. Oh, can't we get back in? Can't we do something? So you have to put a framework around when you think this likelihood could eventuate. Is it 6 months? Is it 18 months? Is it 2 years? Is it 5 years? Because then all of a sudden I think I have an opportunity to frame decisions against that. But I'm really struggling with the softer, it's likely, like if something is highly likely and extreme risk, what would you think is about to happen? I would think the building's about to fall down. Then I get told, no, it's really not that kind of problem. Well, why did you call it that then? You didn't like the other words, like you really wanted to bring my attention to it? So risk is the fundamental issue that boards must address. It is the fundament to dealing with decision-making and strategic thinking around an organization's ongoing viability. And we have to move to a world where we're willing to talk about it in quantitative rather than purely qualitative terms. And that's not easy. I won't say it's easy. And we have to stop confusing issues, problems, with risk. You want to know a risk? You're providing Medicaid to, close to 1 million people, and legislation could pass that changes that. Imagine that. Which means your business disappears. Gone. So the question then becomes, what do you do about it? When might that happen? So that's the framework.
Outstanding. So just to recap the notes that I took here, because those excellent points, especially on the communication with the board, what they need to hear. One is providing context, really just summary, the business context of the issue or specifically the risk that you're presenting, right? What's the business context? Being consistent between reporting sessions. If you're meeting quarterly, presenting monthly, or whatever that period is, making sure that you're presenting the consistent metrics or measures of whatever the issues are that you're presenting. Having that continuity. I love the wagon wheel story that's a great analogy. Being concise. Don't bring in reams of paper. Don't bring in a 500-page vulnerability report with a bunch of technical jargon in it, and making sure that you have the confidence in your message, that you've done your homework, and that you're also confident in when you have uncertainty, because uncertainty and confidence are not mutually exclusive, right? I mean, you can be uncertain about something and say, hey, I'm uncertain. We have some visibility issues here. We have a gap here in our understanding or knowledge of the issue, or even the probability of this event, but being confident about that. Using numbers, and don't tell people what they already know. And I love the quantitative stuff. That's near and dear to my heart. So any final thoughts before we wrap up?
So I was doing well on the C words, right? Consistency, context, and so on. So I'll add one other one, candor. Do not hide the messages. Don't do it. The board is fundamentally engaged in the survival of businesses. That's their mandate. They will supersede, they will outlive, they will carry on beyond any management team. You put them together because they represent a trust of knowledge and information. Do not mislead them, be candid. It's not always easy. I mean, they want you to say, perfect, and you're saying, no. That's hard, but it's essential. You're professionals, do your job, be honest, be candid. And together with the board, working with the management group, what you will find is the way forward, that road to California forward, to evolve the organization to deal with the true potential that the cyber environment creates while effectively dealing with the other side, which is the potential risks that arise from doing that. So I'll leave it at that.